All right, whenever you're ready.
All right. Good evening, everyone, and thank you for attending. I will be covering basic questions or questions that pet owners have surrounding vaccinations and common parasites. And I hope you get lots of information and valuable information from today's presentation. A little bit about myself. My name is Suki, and I graduated from the Ontario Veterinary College in Guelph in 2005. And I have been in private practice since then. I decided to open my own practice in November of last year. So, heading on to our first year anniversary at Balmy Beach Pet Hospital. So, that's pretty exciting. We're located in the beaches, and it really has been fantastic being a practice owner. Okay, so some general information, the questions that were posed to me by Juliana, and that's what I've sort of addressed in this presentation, as to, why we vaccinate and, their importance. Of course, we all know vaccines are very, very important, and especially with, COVID striking, that's definitely been in the forefront, trying to establish or develop a vaccination for COVID. Luckily for our pets, we've got vaccines and they work very, very well for a majority of the illnesses that our pets do get. So vaccinations are basically an attenuated or a weakened version of the pathogen. So pathogen just means a bug. It could be a bacteria, it could be a parasite, it could be a virus. And the idea is to give a small amount of this pathogen into our host, so into our pet or ourselves. And the idea is to stimulate an immune response. So we're trying to identify this in small doses and make antibodies and have protection against these bugs without getting sick from the virus or the bacteria from the vaccine. Of course, the benefits of vaccinations, it's to prevent very serious illnesses in pets, in people, things like distemper or parvovirus. We rarely see those things as much anymore because of vaccinations. A lot of viral infections can also be zoonotic to humans. So vaccinations are important to prevent zoonotic infections as well, so such as rabies, leptospirosis, and of course, some vaccinations are required for your pet, such as rabies. When you bring your pet to the clinic or take them to a boarding facility or to dog shows and whatnot, vaccinations are a requirement. And of course, preventing disease in general is a lot better than to actually treat the disease. Testing and diagnosing and treatment is going to be a lot more costly for you, and of course, a lot harder on your pet as well. So there's a lot of vaccinations that are available for your pet. I'm going to talk about them in terms of which ones are mandatory, which ones are core, and then which ones are sort of available but are more so lifestyle based. So in Ontario, the vaccination that's required is, of course, rabies, and of course, the reason being is this virus causes, invariably a fatal disease, and so prevention is definitely it's mandatory. So rabies is required by law in Ontario. Other vaccinations are called core vaccinations, and that's because they do cause serious disease, and they're common enough that we should be vaccinating our pets against them. So when you've gone to your vet's office, I'm sure you've seen the letters DHPP or DA2PP, and in cats FBRCP, and you may wonder what that is. So essentially, DA2PP is a combination vaccine. It is a multivalent vaccine, which essentially means that there's more than one virus that this vaccine is preventing against. So DA2PP stands for the four viruses in dogs: distemper, hepatitis, or also called adenovirus, parvovirus and parainfluenza. And in cats, FBRCP stands for feline, which means cats, viral, and then it protects against three viral infections called rhinotracheitis, calicivirus, and panleukopenia. So that's what your pets are getting, a series of vaccinations against those things. Now, there are some non-core vaccinations that are available as well, and leptospirosis is a pretty common one that we will discuss with you to protect your pet against, dogs against. It's a bacterial disease that is again, it has zoonotic risk as well to people. So it's a pretty important vaccine as well. Lyme disease is another vaccination for dogs that, go to wooded areas or are cottage country dwellers and, go. So if they're at risk of getting a lot of ticks, Lyme disease is also another vaccination that may provide extra coverage. Bordetella is a bacterial disease that causes coughing in dogs. You may have heard of it as kennel cough. It's not only, dogs don't just get it from visiting kennels. Any place where the dogs are congregating in close enough contact, it's airborne through nose to nose contact. So that can it's pretty contagious, and the vaccine works pretty well for that as well. In cats, the only non-core vaccine is feline leukemia, and that's a viral infection in cats. And we recommend that for cats that go outside or if they dwell within a household with multiple cats. That's also a vaccine to ask your vet about. So vaccinations overall, very, very important for not only the pet safety, but of course the safety of everybody in the home. This is a vaccination schedule that Azra very beautifully developed for me, and it sort of outlines, the stages that we'll be seeing your pup for their first year or two of their lives. They do come to the vet's office pretty frequently in their first year of life. So the first time that the pet is vaccinated is usually when they're around 2 months of age. And generally, a lot of dogs will get this done through their breeders. So the vaccine that they're going to keep, get is getting the same vaccine at 2 months, 3 months, and 4 months. It's the DHPP vaccine that I mentioned earlier. So they'll get that at the first visit, second visit, and third visit. And the reason for the repetitive vaccines is to build a sufficient amount of immune response to make sure that we've got a lot of antibodies to protect your dog against these viruses should they come into contact with any one of those. Some of the other things that we recommend is to have your dog's poop tested, from time to time. Once to twice a year is a good, a good frequency. Not all parasites can be seen, so that's the reason to check for parasites under the microscope. There's a lot of microscopic parasites, and some of these can be zoonotic to people as well. So, for the vulnerable populations like kids and the elderly or people that are immunocompromised, it's very, very important to have regular screening of the poop. And we generally deworm, a pretty consistent deworming protocol as well, especially when they're younger. The younger the pets are, their, immune systems are not fully, not fully developed yet either. So they need a little bit more help in terms of warding off some of these infections and parasites. So Azra has listed here, after we finished our vaccination series, which generally gets done at around 12 to 16 weeks of age. Rabies is given at the last series, which is at 12 to 16 weeks of age. Okay. And after that, rabies is repeated 1 year later. And after that is on an every 3 year basis. Now, how often should you vaccinate your dog for DHPP after their initial series? So that depends largely on your dog's lifestyle. Okay, but I do urge all clients to make sure that the first series, their puppy shots, are done on a set schedule to make sure that we've, really, gotten good immunity against all these viruses. Spay neuter can occur anytime between 5 to 6 months of age. Again, lots of discussion to be had around that as to the pros and cons of spay neutering, and of course, you can address those questions to me later or to your veterinarian, and we can talk about that. Some of the lifestyle vaccines, like I mentioned before, lepto, Lyme, bordetella, can be started again depending on the dog's lifestyle. If your dog is going to be living in the city where there's a lot of wildlife in the city, leptospirosis is something that I recommend. Bordetella is also some vaccine that I highly recommend, just because it's highly contagious and it's easily preventable. So if your pet is vaccinated, it doesn't necessarily mean that they won't get the disease. They might get the disease still. However, the clinical signs resulting from that disease will be mild. Okay, so they won't get serious consequences from the disease because they have some immunity to that virus or bacteria.
Here is a question. So when we get a puppy for first time, there is so many weeks you have to wait until the full set of vaccines are ready for them to go out and socialize. What is that age and why they have to wait?
Okay, so that's a very good question, and I get that a lot. So we've got to think about, we want to make sure that they have an adequate amount of immunity. However, we also want to get our pet out there and socializing. However, I think both of these things can be done in a very controlled manner. I do encourage my, clients to allow their, so the pets don't have to stay in a bubble or a vacuum until they're fully vaccinated at 4 months of age. Okay, I do think dogs need to be, they have to have that social interaction. So I encourage owners to have their dogs interact with dogs of known vaccine status. So, their friends' dogs who are fully vaccinated and fully immune and are not shedding any, contagious diseases. I do encourage that the dogs are getting to socialize with those dogs, and just in making sure that it's a controlled interaction. I'm not a proponent of waiting till about their 4 or 5 months of age before you start introducing your dog to the outside world, to other dogs. I would discourage taking your dog to heavily dense areas with other dogs where you don't know where the vaccine what the vaccination status is, but exposing your dog to the environment is important. Negative reactions to vaccines can occur. However, if we have to think about the risks and benefits of vaccinations, it doesn't mean that you don't vaccinate because of the possible negative reactions to vaccines that may result. The benefits of vaccinating far outweigh the risks of negative reactions that occur secondary to vaccines. So after your pet has been vaccinated, there are some expected or normal vaccine reactions that don't prompt, that you have to take your pet back to the veterinarian. So it's like when you get your, flu shot or any vaccine, we're a little bit sore at the site of vaccination, might be a little red, you may feel a little down, maybe a little feverish. Those are all okay. Those are normal vaccine reactions. That's, the vaccine doing exactly what we want it to do. We want the vaccine to stimulate our immune system to form antibodies, to form all these memory cells so that we can identify and attack all these, invaders, if that's going to happen. So all of these reactions listed on the left side are normal vaccine reactions and usually dissipate within about 24 hours after vaccination. Some of the abnormal vaccine reactions listed on the right side to be aware of, again, not to become consumed by them because they're extremely rare. So, a little bit of vomiting, diarrhea. If that happens within a day or two, I'd like to know about it. Does that mean I'm not going to vaccinate your dog or cat for it? No, but it is something that we should know about. Some hypersensitivity reactions like swelling around the face, or around the eyes, around the nose, around the throat. Those are important to address right away. That means that your dog or cat is having an allergic reaction to some component of the vaccination and needs some intervention. Okay, so usually we intervene by using antihistamines and some steroids to help slow down that immune response to the vaccine. Hives, similar to how you would get hives, is in dogs. What it looks like, it's little, bumps on their skin. So their hairs stand up on their body, and that's what hives look like. And that's also an indication of a hypersensitivity or an allergic reaction to vaccine. Now, anaphylactic type of reactions are very rare. Okay, so after giving a vaccination, and if your pet experiences shock or collapse or extreme difficulty breathing, that's obviously a very serious as they get. And like I said, it's very, very rare. In my 16 or 15 years of practice, I've only seen it once in clinical practice, and and usually these scary type of reactions happen right within the clinic. So usually within a few minutes of getting the vaccines. So luckily the pet is right there in the clinic if that's going to happen. So like I say, I generally don't like to scare my clients with all these reactions. I talk about them on the first visit, but just to kind of have the clients, have it and kind of watch their pet for the first 24 hours.
Here is a question. What happens if they actually have a big reaction of anaphylaxis, but still have an important reaction? What then do you do?
Okay, so it depends. So we would have to start to figure out what vaccine is it that they're reacting to. Okay, so in a pet that had mild vaccination reaction, so severe vaccination reaction, it's grounds for not vaccinating that pet. Okay, so I wouldn't vaccinate that pet. However, for the milder types of vaccine reactions, we'd have to start to iron out which ones is it. Now, the way to do that would be to separate the vaccines. So we're not giving a whole bunch of vaccines all at once, okay? And try to figure out, is it the DHPP vaccine that caused it? Is it the leptospirosis vaccine that caused it? Or is it the Bordetella vaccine that caused it? Mind you, a lot of these vaccines are not highly reactive anyways, but that's the way to figure it out. Now, the DHPP vaccine can be separated into its components. So in a reactive dog, we could just give, say, for example, the parvovirus and distemper, as opposed to giving all four at once. It can be separated. And so I want to add another thing to that. In a dog that I've known to have some vaccine reactions in the past, I will often give them some antihistamines prior to administering vaccines as well, as a way to sort of curb some of that reactive immune response. So next, we'll start talking about some of the parasites that you all wonder about. So parasites, I like to sort of think about them in terms of whether they're internal parasites or inside your pet, or external parasites or outside your pet on the skin or ears of your dog. Some of the common parasites, internal parasites, now this is not an exhaustive list by any means, there's many more, but I'm talking about the common ones. Roundworms, hookworms, tapeworms are the ones that you may see in your dog's poop. But the other ones like Giardia, Coccidia, Toxoplasma in cats, these are microscopic parasites. So you would not be able to see them. You'd have to bring in a poop sample in order to, then undergo some tests on that poop and identify them that way. Heartworms are a parasite that they live in the heart, and they're transmitted through mosquitoes. So that's also something that is very important to test for and prevent against. External parasites, the common ones are fleas, lots and lots of fleas. And right now seems to be the season. I'm getting a lot of cases with pets, clients finding fleas on their pets. Ticks and mites are some of the other ones as well. Of course, there's other external parasites like lice. I've been asked about bed bugs and stuff like that. But those are, the bed bugs are pets are not the natural hosts for them. So we'll focus on fleas, ticks, and mites in this presentation. So prevention of course, both internal and external parasites is, vigilance on the part of the pet owner, following a strict deworming protocol, having the stool tested at least once or twice a year, depending on where your dog hangs around. If they're in high risk areas, then of course we can test the poop more frequently than that. Making sure your dog is on a deworming or a monthly deworming medication to prevent some of these parasites, and checking your pet for fleas and ticks, and bringing that to your vet's attention. If your pet is scratching, if there's hair loss, if there's any rashes, all of those are reasons to rule out parasites in your pet. Now, in terms of parasite prevention, luckily there's many on the market, and every vet clinic will have their favorites that they stock. But really, there's a lot of good products available that will prevent a large number of the parasites that I discussed on the previous slide. So there's monthly preventatives that'll take care of fleas, that'll take care of ticks and mites and heartworms and internal parasites all in one. And again, we can just, you can have that discussion with your veterinarian about whether you want to use the oral product, or a monthly basis, or do you want to do it on a quarterly basis? Do you want to use a topical product? So all of those will largely depend on your, whether your dog is easy to give a pill to, or, a topical product may not be something that you may want to use if your dog is constantly in the water. So that's something to discuss with your veterinarian. Another question that was asked, and I get that asked a lot, in clinical practice a lot too, is why should we even test for heartworm? Your pet's test is always coming back negative. Why bother? The reason is because, again, a lot of the times some of these diseases are easier to prevent than to treat. Okay, and so heartworm disease, I'll tell you a little bit about that, is transmitted through mosquito bites, and both dogs and cats are at risk. Of course, dogs more so than cats because they're outside more. And the infected mosquitoes, they'll deposit a larval form of the heartworm called microfilaria into the host. And then this larval form takes about 6 to 9 months to fully develop in the heart of the dog. Now, these monthly preventatives are meant to only treat the larval stages. It only kills the larval stages, not the actual adults. And sometimes if your dog has this larval form of the worm, this medication can actually incite a pretty drastic immune response to the sudden death of these forms of this immature larva. So it's important to know that your dog is negative before you put them on medication for that reason, okay, so that we don't get a rapid kill of these worms and then therefore, in a huge immune response secondary to these larvae dying in circulation. So, the cost of the test is really, it's really in the grand realm of things, it's not a very expensive test, usually about $45 to $50 to make sure that your pet is negative. And it also tests for tick-borne diseases as well. So there's a lot of reasons to test your dog prior to putting them on a preventative. So this chart just is is the meaning was to just show you that there's a lot of products available, and their coverage. If you're looking for a coverage for everything, you may want to go for a product that's all in one that will protect against heartworm and fleas and ticks and internal parasites. So there's two products called Simparica Trio and NexGard Spectra, which is once a month and is great for all dogs. The only, I guess, limitation would be a dog that is allergic to, say, that has food allergies. So that may be the only reason, maybe not to consider that. There's topical products as well, and so there's a lot of different products that you can use, and have a discussion with your vet as to what's available, and based on the lifestyle of the pet, pick the product that's going to protect against a large number of these parasites.
Here is a question. In terms of people that can afford the most expensive ones, that are typically the ones that are the best, are they still good options that are not as pricey?
There's a lot of options. And I see that a lot of, some clients will go to the pet store or Walmart and pick up, a product for, that'll cover certain stages of these parasites, but not all. So you end up actually spending more money because, not having taken care of the problem right from the get-go. Now we've got infestations because these parasites have been allowed to sort of carry on their so for example, with fleas, you want to make sure that you cover all of the stages of fleas, not just the adults. Okay, so what you see on your pet, which is the live adult flea, is only tip of the iceberg, really. 90% of flea population is in your home and in developmental stages. So just taking care of the adults is really not going to cut it. And some of these cheaper products will only take care of certain life stages and not all of them. So you end up spending more money, I believe, that way. It's better to go, and of course, we can discuss different combinations to make sure that we don't let these, critters become an infestation, because then it becomes a lot more challenging to get rid of them. So I didn't want to gross you guys out with, really grotesque images of parasites. So I put, sort of cartoony pictures here of certain, parasites and what they look like. Fleas are, everybody, I guess everybody's seen a flea. Ticks are pretty gross, and that. So there's a picture in there that'll show some ticks. There's 4 to 5 different species of ticks in Ontario, and all ticks, or majority of the ticks, will carry some sort of disease. Okay, so they carry some bacterial infections that they transmit to your pet and to people as well through biting. And so that's why it's important to test for tick-borne diseases as well. Even fleas can transmit some diseases as well through bites. Okay, some worms on the side. Roundworms is something you can see in the poop. Tapeworm segments, so not the whole tapeworm, but tapeworm segments you can see on your pet. Hookworms occasionally can be seen, and heartworms you never see. It's because it lives in the heart. So these are some of the parasites. Again, checking your pet's coat to make sure that they're not you're not seeing anything unusual on their coat. If your pet is scratching or if having any hair loss, if they're itchy, rashes, all of those things are a consideration for maybe they have some sort of a parasite, and you should bring it to your vet's attention. So fleas are pretty easy to see. They literally look like, the flea dirt is the flea poop. You'll see that as comma-shaped black specks on your pet. Um, Ticks are often, confused for a lump in your pet. So a lot of the times when, the way I've been presented with a tick is, oh, hey, doc, my dog has developed a lump, check it out. And it turns out to be a tick. And the reason it looks like a lump is because once the tick engorges and has a meal, its body swells up with food, and the mouth parts are dug into the skin, so you can't see that. But it's very important that we remove the tick very, very carefully, and we'll go through that in the next few slides. Tapeworm segments are usually, you'll find them around the back end of your dog, around the bum area, and they look like dried rice segments. So the other question I was asked is, can intestinal worms be seen in your dog's stool? Not all of them. Some of them can be seen. Roundworms are pretty easy to see. They look like long spaghetti strands, and you can see them in your dog's poop. Sometimes your dog will vomit them up as well. If they have a heavy infestation of roundworms, they'll bring it up in their vomit. Sometimes they can also cough it up as well. Tapeworm segments can be seen around the bum area. However, majority of the parasites are going to be found by doing some blood tests. So, for example, looking for heartworms is a blood test that we need to do. Checking for tick-borne diseases like Lyme disease and other tick-borne diseases is going to be a blood test as well. So invariably, most of the parasites are going to be identified with some further testing. So it's very, very important to have your pet tested, and it's part of, preventative care, wellness care for your pet.
There's a question. So roundworms sounds very similar to ringworms.
Okay.
But they are different, and what is the difference?
Okay, so roundworm is actually a worm, and ringworm is actually a fungal infection. Okay, so it's a fungal infection, not a worm infection. So it's called ringworm because it forms a ring-like lesion on your pets, and it causes a lot of scaliness and dryness, and sort of as it spreads, it sort of creates a ring. So it's a fungal infection. Looking for ticks is very, very important as part of, preventing tick-borne diseases, not just for your dog, but for yourselves as well. So if you've been hiking or if you've been in wooded areas, it's very important that, you're preventing ticks on yourselves, by wearing full sleeves and making sure you've got your pants or, tucked into your socks so that you don't bring anything on yourselves. Humans are a lot more sensitive to Lyme disease should they contract it, dogs and cats. Okay, so it's very, very important that you prevent ticks on yourselves as well. So if you've been out there hiking or even just, areas where there's, long grasses or bushes or shrubs, it's important to give a look over on your dog every single time. And you want to sort of focus on the hot spots on a daily basis. So ticks will usually latch on around, the dog's head, around the face, neck, chest, legs area. So when the dog is sort of burying their faces into the bushes, that's where the tick is going to latch on. So you want to make sure that you're looking and scanning them for ticks and removing them as soon as possible. And it's a little bit more challenging with dogs that are really furry or hairy or a dense hair coat. But again, focusing on those, high, the head and then head, neck, leg area, you should be able to find it. And it literally feels like a little lump. and you want to get that off as soon as possible. You want to make sure that you're preventing your pets against ticks, because bringing ticks into the household, it may fall off your dog and onto a human family member, and like I said, it's a lot riskier. A tick-borne disease in humans is a lot more serious than in dogs. So when you're removing a tick from a dog, you want to make sure, first of all, you're using gloves. I know this picture is not showing that, but you should wear gloves. And please refrain from using your fingers or from removing the tick. You don't want to accidentally crush the contents of the tick. Use some tweezers and grab the tick from as close to the head of the tick as possible, and use gentle traction to kind of pull it out. And once you've gotten it out, and if you don't feel comfortable, take your dog to your veterinarian and have them demonstrate it, or just have them take it out for you. You want to make sure you remove it properly. And after removing the tick, please dispose of the tick properly. Make sure you kill it, and not, throwing it back outside for it to infest another, or latch onto another dog. So you can put it in a bit of alcohol, and that should kill it. Or you can feel free to chomp on it as well, or squish it. Lyme disease is the sort of the more common, or the well-known tick-borne disease. Of course, there's others as well, but Lyme disease is, because it's so, it's causes a pretty bad disease in people, and so therefore I'll talk about Lyme disease. And so it's carried by the deer tick, or the black-legged tick, and the bacteria that causes it is called Borrelia burgdorferi. And usually a tick that's carrying it bites the host and can transmit this bacteria. And it can, the clinical signs in a pet can take about 6 to 8 weeks before we start to see a positive test, even, or clinical signs. Okay? So that's all the more reason to test your pet, because they may not show any symptoms. So if they're going to show symptoms, which is about 10-15% of dogs, this bacteria will affect their joints, and will cause a lot of painful joints, swollen joints, fever, and kidney disease in some dogs as well. And because it affects the joints, antibiotics, sometimes treatment doesn't work as well, because antibiotics don't penetrate joints as well as it does other tissues. So again, prevention is more important than actually treating, because treatment is always a lot harder, a lot more costlier, and it doesn't always work. The treatment of choice is with an antibiotic called doxycycline, and it's usually given for about 3 to 4 weeks, and it's usually pretty well tolerated. And of course, there's other antibiotics as well. Okay. Last slide. Next slide. Okay. So I was asked about if there's natural remedies that you could use. I tried to look it up I wasn't aware of anything. I tried to look it up. I'm not confident in recommending anything after looking it up. And largely because, like I said, you want to make sure that the product that you use will get, the developmental stages of these parasites, and not just, focusing on one particular stage of these parasites. You want to make sure, like, if you're going to get rid of it, you want to get rid of it completely in all its developmental stages, and the adults. So for that reason, I will encourage you to consider getting preventative medication through your vet's office, rather than, say, from over-the-counter Walmart, or from a pet store. Okay. And again, a lot of these products will, like I said, prevent against a lot of things, not just, say, for example, fleas. They're preventing against multiple parasites, fleas and ticks and mites and internal parasites. So that's advantageous. Okay. And There's a lot of stuff, if you have further questions, beyond the scope of today's lecture, please feel free to use some of these websites, without because Google can sway you, in ways that is sometimes inappropriate. It may, make you too alarmed for something that may be very, very minor, and vice versa. Where something is very, very alarming and may make it seem like it's not so. So it's important to seek veterinary attention anytime you have questions. But veterinarypartner.com is an excellent website resource for clients to go on and virtually get any number of information. There's a lot of, I mentioned dental conditions, and that's because I'm very big on oral health. And I think there's a lot of misconceptions around, oral health in pets and dental.